On behalf of my co-authors, I would like to introduce our poster. Thymidine kinase 2 deficiency, or TK2D, is an ultra-rare autosomal recessive disorder marked by mtDNA depletion and/or deletions, resulting in clinical symptoms which include progressive muscle weakness, motor impairment, feeding difficulties, loss of independent ventilation, and oftentimes premature death. TK2D is a progressive condition highlighting the need for early recognition and diagnosis. Previous research suggests that mitochondrial diseases are difficult to diagnose due to their rarity and phenotypic heterogeneity, as well as a physician's lack of awareness of these diseases. It is not uncommon for patients to consult an average of 8 or more physicians before obtaining a diagnosis. We conducted a telephone survey of 11 international physicians, including neurologists, neuromuscular specialists, and geneticists, with experience managing TK2 deficiency. From these interviews, we learned that patients are often referred from their primary physician to either a neurologist or neuromuscular specialist, but less often to a geneticist. Misdiagnosis was common, and therefore having a referral to an appropriate provider is important. Modified Delphi surveys have been used in the past for other mitochondrial diseases. Because accurate and timely diagnosis can lead to initiation of treatment earlier with the hope of preventing disease progression, we feel there is a need for consensus guidelines for identifying and managing patients with TK2D, and that using a Delphi approach will help to achieve consensus and narrow some of the gaps that we see in clinical practice. Our poster highlights a proposed process and sample statements that can be used for a modified Delphi survey with the goal of obtaining consensus on the diagnosis and management of TK2D.